Hi, my name is Nicole Steinbauer. I am the behavior analyst for the Acute Unit here at Springbrook, and today we're going to go over some of the strategies and things that can help families when their children are showing signs that they are in crisis in the home setting. So during this presentation, we're going to touch on a few things. To start out, we're going to talk about how we can identify if a situation has become a crisis. We're going to look at some strategies that can help stop a crisis before it starts. We're going to look at some things that can help keep you and your family safe during times of crisis. And then we're going to talk about the next steps that we should take after a crisis situation has occurred. To begin, we're going to look at functions of behavior. There is another presentation that was completed that really digs into functions of behavior, so I'm not going to go into too much detail. But to start out with, one of the main functions of behavior is attention. When our kids are looking for attention, whether it's positive or attention or negative attention, they're going to engage in a behavior to try and get that attention. Next is access to a tangible or an item. So they want something and either they were told no or they're struggling to communicate the item that they want. And so they'll engage in a behavior to gain access to that item. We also see one of the functions of behavior as escape. So our kids are trying to get out of a demand, they're trying to get away from something they don't like, whether it's a person or an environment. And so they'll engage in that behavior to escape that environment, situation, person, any of those things. And finally, we see one of the functions of behavior as being sensory driven. So a lot of times sensory driven behaviors you see across settings. They're at school, work, community, home, and sometimes we can't tell what the trigger is. Sometimes we can. Sometimes it might be the lights are too bright in the room, it's too loud. Any of those things. But yeah, those are the main four functions of behavior. So after we talk about functions of behavior, we might wonder how those are going to look for our kids. So I kind of broke down between children who are high needs and low needs and what their behaviors might look like. This isn't set in stone, so some low needs kids may engage in behaviors that we usually see in high needs and vice versa. So for our high needs kiddos, we might see behaviors due to a breakdown in communication. That means that they're struggling to tell us what they need, what they want, and all of those other types of things that can happen in a breakdown in communication. Next can be an access to a tangible item. So this can be kind of connected to the breakdown in communication. They're struggling to tell us what they need, what they want, the item they're looking for, and then they might engage in maladaptive behaviors in those moments when they're struggling to get access to that item. It can also just be basic needs. So some of our kids, they might struggle to communicate if they're simply hungry or thirsty or they're tired, and so they get frustrated and they engage in problem behavior. Finally, we might see some behaviors from our high needs kids when their environment isn't matching what they need. So similarly to the last slide, the lights might be too bright, the environment might be too loud, it might be too cold, might be too hot. All of those things can kind of lead us to seeing behaviors in regards to the environment. Now, when we look at our low needs kids, a lot of times we see their behaviors stemming from denied access. So we've told them they can't do something, they can't have something, any of those types of things, and so they engage in problem behavior because they want the item they were told no. The other one is non-compliance. So similarly with denied access, they either do or don't want something and they're not going to comply with what we're asking. And so it could be anything from take a seat, let's finish this worksheet, let's go to the gym, something like that. They don't want to do it, and so when they're told no, you have to do this, we might see problem behavior at that time. And finally, demands can be a big trigger for our lower needs kids. So, similarly with non-compliance, we're asking them to do a worksheet, we're asking them to listen, we're asking them to complete chores, and they just don't want to, and so they're going to engage in problem behavior to get out of that. Again, these are not exclusive for our high needs and low needs, but these are some of the big triggers that we see across these groups. So when we get into crisis situations, problem behaviors, those types of things, one of the first things I ask my parents is if any of these things could be related to a medical concern. So that could be, anything from stomach pain to issues with current medications, to anything else that really just could be going on in our children's bodies that we just can't tell. So I always recommend talking to your doctor first when behaviors arise, especially if they arise suddenly and quickly and they're highly unusual for your kid. We just want to rule out those medical concerns before we start addressing behaviors in a behavioral analytic type of way. After we've been able to rule out medical concerns, I usually have my parents start with collecting ABC data. When we talk about ABC data, what we're looking at is the antecedent, the behavior, and the consequence, and those relate to, ABC. A, antecedent, B, behavior, C, consequence. So what that means is for the antecedent, we want to look at what's going on before the behavior happens, and then obviously we want to see what behavior is occurring, and afterwards we want to see what happens after the behavior or the consequence. Sometimes when we hear consequence, we think of something negative, but in ABA talk, that just means whatever happens after the behavior. So I always have my parents kind of start doing this, and you can do it, whether it's in your head or you're writing it down, or sometimes if you already have a BCBA, they might give you a data collection sheet. And so we want to start doing that so we can narrow down what's going on around these behaviors and what's the best way to treat it, and that's why ABC data can be very beneficial. I also like to talk to my parents about precursor behaviors. So a precursor behavior is a behavior that they might engage in before they engage in the bigger problem behavior. This could be seen as an antecedent to the behavior if we're thinking about it in terms of ABC data. One of the ways that this can look, if we're thinking about kids, that I've seen on the unit or in the past clinics that I've worked in, is maybe pacing. So sometimes our kids might start pacing before they engage in a higher level of problem behavior. They might clap their hands, they might remove themselves. There's many different ways that precursor behaviors can look. And I always like to tell my parents, you know your child best. And so a lot of times parents have an easier time picking out these precursor behaviors, and if we can identify those early on, we can intervene early on. And using your data from the ABC data can also help you identify these precursor behaviors. Now that we've kind of talked about all of those before treatment options, let's start talking about some interventions we can use in the moment. I always like to start off with antecedent interventions. So these are interventions that we can do before a behavior occurs, and even before we see precursor behaviors, to kind of prepare and avoid those higher level behaviors that we might see. So again, I just want to mention ABC data can really help us identify these things. So when we take that ABC data and we look at the antecedent portion of it, we might see some consistent issues with the environment. So maybe a certain song turned on or the TV turned on before these behaviors. And so we can prepare ourselves for these. We can make sure that our lights are lowered if it's a light that can be triggering to them. We can, only have TV at certain times of the day. We can avoid certain songs, certain, TV shows that can be a trigger, or any of those other things that we notice. Another thing is thinking about what you're saying to your child, especially if they're triggered by directives, demands, any of those types of things. So I always talk to my parents about changing their language to try and be as positive as possible. And I can give you an example of that. So if our child asks to draw right now, but we're working on schoolwork, instead of saying, no, you can't draw right now, you could say something like, I like that you want to draw. We can draw at 11:30. And so you're acknowledging that they want to draw. You're still telling them you can't do it right now, because you're giving them the time that they can do it. And so that kind of helps them solidify a schedule in their mind. They know that it's coming, and then they know they're going to be able to access that reinforcer in a certain amount of time. It also removes no out of your language. No can be a very triggering word for some of our kiddos that we work with, and so just kind of thinking about what you are going to say to your child and the most positive way that you can phrase it can help reduce the chance of problem behavior. We also like to kind of look at power struggles. So power struggles can be a very big trigger for higher level behavior. And what this means is, if we're at home and we don't want to have our kid, let's talk about coloring again. We're trying to get dinner ready. They want to color on the table. We don't want them to color at the table right now. We're setting dinner up. And so instead of saying, no, you can't color right now, let's have him color in a different spot. Let's give him a clipboard, or he can color at the coffee table or up in his room. And so trying to figure out, am I saying no right now because it absolutely cannot happen, or am I saying no because of other reasons? And then trying to figure out a way to work with your child in that moment to get them that reinforcement while it still works with what you're trying to get done. And then finally, I like to kind of talk to my parents about making a calm area for their child. So this could be in their bedroom, in the basement, somewhere where we can kind of control the environment a little more. We might put a beanbag in there, some really good squish pillows, maybe some lights that kind of turn the ceiling into like a constellation or something. Any of those things that can be a calming moment for our children. And this can be beneficial because we can direct our children to go take a break, why don't you go play with your calm down toys, something along those lines, when we know that a behavior could be coming. And so we can kind of get into the habit of prompting them to help regulate themselves in that moment. If antecedent interventions were unsuccessful, then we're going to want to look at things that we can do in the moment. These can be very different per kid because crisis levels can be different per family and child. Some crisis levels could be punching holes in the walls, throwing chairs, throwing tables, trying to attack parents, while other crisis moments for other families might look like high levels of suicidal comments, locking themselves in the room, running away, those types of things. So these can really vary between kid. But we found that a lot of these basic skills that we can use in the moment can be very beneficial, no matter what that crisis level is. So first, I always remind my parents to lower your volume. When we speak up and feel like we need to raise our voice, our children are going to feel like they need to raise their voice to be heard. And so we're either not going to talk, or we are going to talk in the lowest volume that we can while still being heard. A lot of times verbal directions and verbal instructions can be even more triggering in a crisis situation. And so on top of lowering your volume, you want to lower the amount of directions that you are giving. If you feel like you need to give a direction in that moment, then let's try and decrease the amount of words that we're using. So instead of I need you to sit down, you're going to just say sit down or sit, to try and avoid overwhelming your child in the moment of an escalation. You're also going to utilize planned ignoring, and this kind of goes along with just not even speaking. So in the moment, And especially if, nobody is in direct danger. We're going to just ignore the behaviors that are occurring. This can be done with precursor behaviors as well if you feel like they're trying to gain your attention. So we just don't say anything. We don't acknowledge the behaviors that they are engaging in at that time that could be problem behaviors. Now, if your kid is smacking the wall, throwing toys and stuff, and then all of a sudden they sit down and they're looking at you and waiting for an instruction, you can end planned ignoring. You can reinforce them sitting down. I always tell my parents we are not ignoring the child, we are ignoring the behavior. So the second your child does anything that is appropriate, we can reinforce that, even if you are utilizing planned ignoring in the moment. If they go back to those problem behaviors, we go back to ignoring those behaviors. Do want to reiterate that this is really only for a lower level behavior. If they're really aggressing at you and they're throwing stuff at you or your other children or your spouse, planned ignoring might not be the best idea in that situation. Another thing I let my parents know is to just be aware of how you're standing. So if we're crossing our arms, if our legs are spread out and we're have a wide stance on us and we're facing them directly, that can be a little bit threatening in the moment. And while we might feel threatened in the moment, we want to remember that our kids are not functioning at the same level. And so we want to be as low of a threat as possible. We might turn 45 degrees to them so our side is facing them. We might put our hands in a clasped position in front of ourselves. And just utilizing those few things in regards to posture can help us seem less threatening in the moment and can help decrease our problem behaviors that we're observing at that time. A lot of times I'll hear, I tried that, so what do I do next? First, I want to touch on that. When we try something, sometimes it takes a couple tries to get through to our kiddo, and especially our kiddos with autism. They need a lot of repetition to kind of get into the groove of things and understand what's going on. And so I always recommend, even if you feel like it didn't work the first, second, or third time, to continue using that, the lowering your voice, the non-threatening posture, and all of those other things we should continue to work with and try in those moments. But there are other things that we like to do if we feel like those concepts are not working for us. So, they're further escalating, all of those interventions aren't working and we need to do something else. So the first thing that I always tell my parents is to sanitize the environment. And that doesn't mean taking a Clorox wipe to your table. It means removing things that could be a danger in the moment. So if we're in the playroom and our kid is starting to really escalate, we're going to move all of those toys away from them. And we're going to, turn the lights down, get anything away from that area that could turn into something that could be thrown, broken, any of those things. And we're going to try and do that as quickly as possible. Next, we're going to remove others. So if you have a spouse, if you've got other kids, we're going to remove them out of the environment. Sometimes we feel like we need to remove the kid that's engaging in those problem behaviors, but there are times where that can be really difficult, especially if they're being physical. It could be really hard to get close to them and move them. So instead, we're going to just remove everybody else who is being compliant in that moment and get them out of the environment so that they can stay safe, and also so that attention is removed from the child. You're also going to call for help. This could be a neighbor, grandparents, and sister, brother, or even down to 911. These are all options that we need to utilize and kind of use our support system in times where we are feeling like we are losing control of the situation. 911 can be a scary thing to call, but especially if they're hurting themselves or others, they can help get them to an ER, and they can help, or they can even just help de-escalate the situation. Sometimes having a new face enter the room during an escalation can actually just snap them out of it, especially if it's a face they're not familiar with. I'd also recommend removing yourself. This isn't always applicable, especially with our younger kids. We don't want to leave them in a spot where they're going to hurt themselves. But if we feel like the child needs time away and we can't get them into their calm spot, or into their room, or somewhere else, then we want to try and remove ourselves. And you can still just be in the same area, just very far away. So if they're in the kitchen, you're on the other side of the kitchen or around the corner with your ears open, listening to what's going on. And so you can just still be aware, but you are keeping yourself safe. And then finally, like I said, you can direct them to their calm area. We like to avoid directions, but if you're trying to give them a direction to keep them safe, I think that's applicable in the moment. When we give directions, we don't want to ask. So we don't want to say, will you please go to your calm area? We want to say, go to your calm area. We don't want to give them the chance to say no. They might still say no in that moment, but it is more likely if we phrase it in a question than in a directive. Finally, I'm going to talk about what we can utilize in our community and other resources to help us after a crisis incident has occurred. So I want to start with outpatient services. If your child has an autism diagnosis, I would definitely look into a recommendation for applied behavior analysis, or ABA therapy. The reason for this is because ABA can be a very high frequency, and they can come into the home setting, they can go into the school setting, the community setting, and the clinic setting to work on these behaviors. And especially in the home setting, I think it's important when we're seeing more crisis level behaviors that it's important for us to try and get help in the home setting. Sometimes our children don't engage in behaviors outside of the home setting, and so we want to address those behaviors in the setting that they are occurring. We can all, as we discussed earlier with the functions, it can be a sensory issue as well, and so I always like to look at occupational therapy for my kiddos that are struggling in that area, as well as speech therapy for our kiddos who might be struggling to communicate their needs. We can also use speech therapy for our lower needs kids. We might not feel like they need it when they're able to communicate fluently, but sometimes they just need help understanding directives or pragmatic language, and speech therapy can be very beneficial in that area. So after outpatient services, we always want to start with the least restrictive, which would be outpatient, but if those just don't seem to be working, it would be good to look at it inpatient. Here at Springbrook, we have an acute inpatient as well as a residential inpatient treatment facility, but there's other options out there as well. There's other inpatients, there's group homes, and other things that we can kind of look at to help with med stabilization, behavior stabilization, and coping skills that we can help work with your kid on. So yeah, thank you guys for listening. Of course, we're always here to help, and we're always taking referrals, so definitely look at that, and it was great working through this stuff with you guys today.